Kumusta? Magandang umaga to everyone. I am Dr. Herbert Carpio, the Executive Director of Childhope Philippines Foundation, Inc. Thank you for this opportunity to share to all of you the works of Childhope towards our beneficiaries, the children in street situations or street children. A bit of a background, Childhope Philippines Foundation is a not-for-profit, non-government organization, and we work towards promoting the rights and welfare of street children in the Philippines. We are registered, licensed, and accredited by the Department of Social Welfare and Development as a social welfare and development agency. We envision a Philippines where urban poor children, especially children in street situations, or CISS, gain access to the fulfillment of their rights, have them protected and upheld, for them to develop and become accepted and responsible members of society. Our mission is to work towards the protection and fulfillment of these rights of the child through integrated direct service programs in education, health, and social services. And all of these are aimed at the holistic development of Filipino street children, particularly in Metro Manila. So the board, the staff management, even the volunteers of Childhope Philippines adhere to the core values of the organization, which are compassion and commitment to children, integrity, and also teamwork. When we talk about the beneficiaries of Childhope, we define them as a boy or a girl aged under 18 years of age, wherein the streets have been the source of livelihood or the habitual abode. So dun sila tumitira. They spend a lot of time on the streets. And that no responsible adults are there to protect, guide, and direct them. So nowadays, street children are termed as children in street situations to avoid giving that stigma to their presence on the streets. So actually, we work with three categories of street children. We work with community-based street children or children on the streets. We also work with children of street families or the children of the streets and the completely neglected and abandoned children. So community-based, they're termed as community-based because after spending a lot of time on the streets, they go back to a more or less permanent dwelling place situated in an urban poor community uh, uh, away from the streets. Most of them still have connections with adults, guardians, or parents. Okay. Children of street families, they're the ones that you see alongside the streets and sidewalks, under bridges, in abandoned buildings. Um, a lot of them still have relatives, but being on the streets themselves, they are exposed to the hazards and risks on the streets 24/7. Then you have the completely neglected and abandoned children. Ito, they really have no more connections with any guardian or responsible adults, and they tend to form these groups. Commonly, we see them as gangs, but based on our experience, this is not for anything illegal, but merely because they wanted mutual protection amongst themselves because they are very much uh, exposed and victimized by adult perpetrators around. So Childhope works to attain and achieve the Sustainable Development Goals, particularly goal number 1, no poverty, goal number 2, zero hunger, goal number 3, good health and well-being, number 4, of course, quality education, number 8, decent work and economic growth, and of number 10, reducing inequalities. So we do this through our flagship program, the Street Education and Protection Program, or the STEP program, which is anchored on the pillars of caring, healing, and teaching, thus providing a holistic uh, intervention to address the needs of our street children beneficiaries, including the youth, and also as an indirect beneficiary, the families. So under the STEP program, we have components of education, social welfare interventions, primary healthcare initiatives, and skills development opportunities. Under education, we have the Kalye Eskwela Mobile Community Learning Hub. Um, this is carried out through our street educators who teach children alternative education sessions, commonly using the Kalye Eskwela van, which is equipped with audiovisual equipment, mobile internet, portable gadgets that they could use to access the internet and other learning opportunities. Under education, we also have our Street Youth Empowerment Program, which is Project Bamboo. With social welfare interventions, we have hashtag Delivering Hope, wherein we do counseling, referrals, relief and material assistance. Under that, we also have the Calienderia, our mobile soup kitchen, which provides food aid to displaced families, especially during crisis. Under primary healthcare initiatives, we have our mobile primary care clinic, the Clinic Kalye, manned by a full-time doctor. Provides medical consultations, laboratory testing, provision of medicines, multivitamin supplements, first aid, and health education. And our skills development opportunities are carried out through our hashtag I Give Hope community, which is a community of volunteers. So these are volunteer initiated and volunteer led activities that are done with our with the participation of our street children beneficiaries. So several partnership opportunities are available when you choose Childhope to be your partner. We have, of course, fundraising and grants and volunteer opportunities. Um, Grants and fundraising, of course, this is needed by every NGO in order to support the programs and projects that is being delivered by the organization. So as I've said a while ago, this is education, health, different social welfare initiatives, and of course, skills development. Um, yeah, skills development activities. In terms of volunteer opportunities, volunteers can be street educators where they render field work under the program, shadowing the functions of our teachers and social workers on the streets with the children. So you see there are alternative education sessions, basic literacy and numeracy sessions that are being carried out and delivered by our street educators. We also have office-based volunteers. They are volunteers whose primary duties are carried out in the office, mainly clerical works, and these are supervised by the heads of units where you get to be assigned. We also have on-call volunteers. Um, these are volunteers whose skills and expertise are being called for whenever there is a need for them in the foundation. For example, creating brochures, AVPs, those who are photographer hobbyists, Those are some of the on-call volunteers that we have, especially during activities that are being carried out by the organization with different partners. We also have volunteer healthcare personnel. These are medical personnel with proper education and trainings, with or without valid license to practice in the Philippines. They could be foreign or local, and are assigned exclusively under the Clinically Mobile Primary Care Clinic with our medical doctor. Last but not the least, this is where most of you might be able to participate. We have outreach volunteers. We support outreach activities which are conceptualized and carried out by our volunteers, because this is a way of reassuring the children that there are people outside of the Childhope team that are very much concerned with their welfare, and are willing to help them develop self-confidence and self-esteem. Example of outreach activities, you have art sessions, some carry out field trips, parties with games with the children, and preparing and distributing food under our calendaria. So the following video are the accomplishments of Childhope during the past year.
It is with great pride and satisfaction that we share with you our achievements and milestones in continuing our mission of providing hope and empowerment to Filipino street children. In the face of adversity brought about by the pandemic and other challenges, we remain and continue to be a beacon of hope for these children who are often marginalized and forgotten by society. The collective initiatives and full dedication of our staff, donors, partners, and volunteers to serving them has only gotten stronger, and our commitment to creating a better impact for them is unwavering. We invite you to take a closer look at our collective work and the impact it has on the lives of street children and the youth of Metro Manila. Welcome to the annual report of Childhope Philippines for the year 2022. hope that you will join us in celebrating our successes and in continuing to support our mission of creating a world where every child's right to a safe and dignified childhood is respected and upheld. We are a street child's hope.
And with that, thank you very much for the opportunity. And like our tagline, we are a street child's hope. Hindi lang po kami, hindi lang po kayo, kundi tayo. Sabi nga nila, it takes a village to raise a child. We look forward to a very fulfilling partnership with you. Magandang umaga po sa ating lahat.